Hello and welcome. Today we're going to be talking about a subject that is near and dear to my heart, which is introduction to personal cares. My name is Rosalind Anderson and I will be your presenter today here at Caregiver Chat TV. So before we get started, what is Caregiver Chat TV? Caregiver Chat TV is dedicated to empowering caregivers through engaging and informative content that blends education with humor. Our mission is to provide a supportive community where caregivers can learn about the latest news and best practices, earn continuing education units, and connect with others in the field. We strive to enhance the caregiving experience by offering resources that inspire growth, foster connections, and promote well being. And again, welcome to Caregiver Chat TV. So, what is personal care? The term personal refers to tasks that are concerned with the person's body, appearance, and hygiene. It suggests privacy may be important. One thing I want us to focus on throughout this training is the word personal, right? That one thing that is unique to you, that is unique to you. That's what makes this training, like I said, to me, so near and dear. That uniqueness, that thing about you that makes you you. Some things to remember is that number one, personal hygiene is important and it's necessary. Number two, know what areas are included with good personal hygiene. We call these I call them the hot boxes. So those areas that can get sweaty, provide moisture, things like that, odor. So we're talking about from your feet at the bottom to your private area, front and back, moving up to like the folds in the skin, underneath the breast, under the armpits, the mouth. Those are what we call areas to really focus on when we're talking about personal hygiene. Number two, offer choices as often as you can. And then number three, understand that respect and professionalism should be an everyday way of life as a care provider. So before we move on to the next video, I got a chance to sit down and have a short conversation with two caregivers who are in training to enhance their experience and their knowledge and their career. And I just got a chance to interview them on what they felt, right, were important qualities of being a good caregiver. So I just want you to take some time and play the video. And I hope that you learn something, want to get something, and just kind of enhance your thoughts as well before we move on. So I want to thank you for being my special guest here on Caregiver Chat TV. And if you could just introduce yourself to the audience.
My name is Tangi. I am a CNA here.
My name is Shania. I'm a CNA also.
So we want to welcome you to Caregiver Chat TV, and I just want to go and ask two questions to our special guest. The first one will be, what qualities do you possess that make you a good caregiver? And the second one is, when you're working, what qualities in other people, right, will make your job easier as a caregiver? So who wants to go first? So again, the first one is, what qualities do you possess that make you a good caregiver?
I would say being on time and good communication.
Okay.
For the first one.
So why is being on time the most important? Because you said that one first. So why is that one the most important?
I would say because it shows, like, who you are.
Okay.
I guess.
So what kind of person you are,
Yeah.
right? So I love that, because it also says that you respect me
Mhm.
and I respect you,
Correct.
right? So if I'm on time, that means I can leave on time.
Right.
Correct.
Right? So I don't have to work over. I can get out the door to my family or whatever else I want to do. Okay, Miss Tange, what qualities do you possess that make you a good caregiver?
I would say patience.
Okay.
Because most clients, most elderly people, they need patient people around. And I also would say respect.
Okay.
Because that's very important for us as adults to still, regardless of the situation, we still have to respect the people that are around us and the people that we are working for.
Okay, I love it. So, question number 2 to both of you at work, right? So, while you're working, so you both are caregivers, right, in your own right, and you're taking a CNA class to just make your pay scale go up, of course, right? And then you're learning more skills.
Correct.
So, you'll be even better caregiver, right? So, what qualities do you think other people, right? What qualities in other people are important to you
I
as a
would say
caregiver?
privacy.
Okay. Why would you say that?
Because some people, they don't, give them privacy. They, let others know their personal business.
Okay.
And, you know.
That's very important. And most people don't know, right? Like our social media has become a problem, right? Especially as care providers. It's become a problem. We want to video everything, right? We want to go live everywhere. You know what I'm saying? All those different types of things. We want to TikTok.
For sure.
We want to do all those things, but privacy is so important and so vital, right? Because it could be a HIPAA violation.
For
Depends
sure.
on what we're recording and what we share.
Correct.
Right? So excellent. Ms. Tange, what at work, right? What are some qualities that are important to you?
Teamwork.
Teamwork. Okay. Why teamwork?
Because I feel like everyone should take part in helping another teammate when dealing with clients because sometimes they require assistance. And I think that's important to me.
I think it's everything, right? Like we're a team, right? We're in this thing together. And I think what most people don't know is when one falls, we really all fall,
for sure,
right?
like a
If
domino
one
effect.
drops the ball, we kind of all drop the ball.
For sure.
And most people don't look at it from that perspective. But when one look good, hey, we all look good,
for
right?
sure.
So just those types of things I think are super duper important. So I just want to thank you both for just sharing your thoughts, and hopefully you'll tune in to. I hope that something was sparked from the video. And right now, I just want to dig a little deeper when we talk about qualities of a good caregiver. Some things that they expressed were being on time is key. As I stated in the video, it just shows that you respect me as a peer, and I hope to be on time to respect you as well. Right? So if I can get off on time and be with my family, on time, right? That allows me to come home and do the things that I need to do in a more pleasant mood, etc. Good communication is another piece that is important. Now, we're just not talking about what we say, we're talking about how we may say it. So, our body language is key. So, we need to make sure, as care providers, caregivers, whatever capacity of care, that you watch what your body says, right? So we want to make sure that we're doing that. We also want to be good communicators. Written, to me is nothing worse than trying to read someone's notes or something like that, and the spelling is terrible, right? So we want to make sure that if you know you need a dictionary, go buy one, request one, but be a good communicator. Most of the time, we are what we call the front line, which means we are the first faces that families will see. So it's important to understand how we communicate. Are we respecting people's boundaries? When people ask us something, are we giving them a good answer in the right tone, in the right pitch and voice? So we want to make sure that we're doing that. All right, being patient was another one that they brought out. Being patient. Patient means I am allowing you to be you, right? I'm being patient. If it takes you 5 minutes to button up a shirt, it just takes you 5 minutes to button up a shirt. And I'm going to be patient enough to allow you to do that to maintain your level of independence. respectful. We heard the song. Aretha Franklin made a song about respect, right? And one of the verses says, "Find out what it means to me." And so that's something that we need to think about as care providers is what does respect mean to me? What does respect mean to you? So I need to be respectful. I need to be respectful of your religious preferences. I need to be respectful of your food choices. I need to be respectful, right, of your traditions, your values, your beliefs, maybe how you dress, things like that. So I definitely need to be respectful and not be judgmental, even though I may not agree with what you're doing. That's not my place. My your goal is to be respectful. Am I knocking on your door, right? When I want to come in, or am I just walking in? Just those types of things. If you're in a conversation, am I interrupting you, or am I waiting until you're finished? If your family is visiting, am I interrupting? Am I being rude, or do I wait and be politeful and wait for your family to finish their visit? Just whatever capacity. We always want to keep respect at the forefront. Teamwork. Oh, I'm sorry. Privacy is the next one, right? Are we respecting people's privacy? Are we putting, um, are we using as a CNA? Are we using a bath blanket when we're giving someone maybe a bath in the bed, or are we just uncovering them where their body is exposed, right? Just things like that. We want to make sure that we're providing a level of privacy. Are we closing the door when they're using the restroom, or do we keep the door open? All the things that we tend to bend at because we get lackadaisical, or we just don't tend to hold that level of privacy as high in esteem as it should be. So that's very key. The next one is teamwork. Oh, something just hit my mind. Privacy as relates to maybe their medical records, and things like that. So we definitely want to respect that, or their medications. We don't want to share those types of personal things with others that we shouldn't be sharing. Then teamwork. We heard the cliche, teamwork makes the dream work. There's no I in team, and that is so fitting. I need all of us to play a role and to play a part, because when one of us look good, we all look good as a team, right? We look good as a team. Next one is emotional stability. As care providers and caregivers, are you keeping your emotions in check? Are you quick to fly off the handle if a family asks you a question? We want to make sure that we're emotionally stable, that we're emotionally mature, that we're able to listen. I heard the in the words of Judge Judy, listen twice. That's why you have two ears and one mouth for a reason. Listen twice, speak once. All right, next one, empathy. Do I express a level of understanding? Am I responsive to that? Or do I just go around calling you a crybaby because you're complaining? No, I want to say, you know what? I understand that you're in pain. Maybe I'll speak to the charge nurse and see if we can get you some kind of pain medication. Not, oh, well, all you do is complain, suck it up. No, that's not being empathetic. Flexibility, understanding as care providers and caregivers in whatever capacity you have, we don't necessarily work a 9 to 5 shift, most of us. And what I mean by that is our days are never the same. Every day is something new, right? Like, okay, I thought I was getting out of here at 5, but right before I was about to walk out the door, um, Mr. Jones had and explosive bowel movement, and I had to work with the next shift and get them cleaned up. So instead of getting out at 5, I didn't get out until 5:30. That's being flexible. Because a lot of things, most of the time, it is outside of our control. So we want to make sure that we're staying flexible, that we're staying bendable, so that we can continue to provide great care. Good attention to detail. I used to have, years ago, um, we prov- I, in terms of the team, and I provided care to someone who was having some sight challenges. He wasn't diagnosed officially as legally blind, but there was some sight challenges. And so every single morning, we would have to inspect him to make sure that he would put his shoes on the right feet, on the right foot, right? So he was notorious for coming downstairs with shoes on the wrong foot. And so every day I would say, how's your feet feeling? Oh, they feel fine. And I'm like, are you sure? Because you got your shoes on the wrong foot. Oh, do I? And then he would switch the shoes out. Now, what would happen if I allowed him to go out the door representing the team, and then he gets to where he's going, and they discover that his shoes are on the wrong foot? The first thing they're going to say is, who allowed him to walk out the door with his shoes on the wrong foot? They will blame the team because we didn't pay attention to the details. Okay. So, whatever the details are, if you know that your client needs extra moisture on their skin, please do that, especially as people of color. In the seasons change, we may use moisture, need added moisture more often than other races. So, just some of those things that we want to pay attention to, making sure that the body is lotioned, making sure, uh, if they have long toenails, that we're getting in touch with the podiatrist, things like that. We want to pay attention to those small details, um, so that the resident continues to look good as well as feel good, so that there is, um, our team is being celebrated. Not just one person, but all of us as a team collectively. All right, the next one is interpersonal skills, how well we interact with one another and how well we interact with our resident. Are we coming in and saying good morning, hello, how are you? Right? We're answering the phone. Hello, such and such residence, or good morning. This is right, ABC, um, nursing home. Whatever it is, how well are we interacting? Physical endurance. Can we physically do the job? Okay. Are you able to carry a basket of laundry up the stairs? Or do you get tired on stair one? Right? So, are you able to physically do the job? Are you able to lift? Are you able to rotate? Are you able to transition? Are you able to use a gate belt? Whatever it is, are you able to do it physically as a care provider, or do you need a caregiver? Next one, problem solving. How well can you solve a problem? Okay. Are you a fixer? Okay. Are you a fixer? I hope that we're all fixers. I hope that we can think on our feet quickly to solve a problem. If you see someone choking, is the next one, is there a quick response? Or do you just look at them? Okay. Or do you tell yourself, you know what? I've been trained, so I know how to give a domino thrust to help push an object out. Whatever it is, are you a quick responder? So, just these are some qualities I want us to just focus on about being a good caregiver. And sometimes, the longer we've been in the field, we tend to lose some of these qualities. We allow life to hinder us from being as amazing as we are, right? As awesome as we are, as needed as we are. We allow life and circumstances to begin to take these qualities away from us that bring so much integrity and importance to the field. You know, during the pandemic, everybody who was in the healthcare role and lane, um, some caregiver in whatever capacity, were called heroes for the first time. A hero? Oh my goodness, what an amazing title to give someone. Okay? That just describes someone who is so selfless. And so we want to bring that integrity back. And I love that this list, every time I teach it, this list just sparks something in me and really forces me to examine my areas, right, where I've kind of lowered the bar. I want to constantly keep that bar raised so that I can be the best version of me, right? So that my team continues to shine, prosper, and move forward. Personal care. When assisting someone with their personal care, again, focus on the person's body, appearance, and hygiene. Assisting with personal care. Encourage those in your care to do as much for themselves as possible. Allow them to have a voice as well as a choice. If I don't want to uh, eat my peas, you shouldn't have to force them down my throat, right? I have a voice and I have a choice. Whether I am verbal or not, you can still allow me to have a voice and a choice. So if I push your arm away, that tells you that I don't want it, right? So it's just some of those things that we need to just think about, because again, having a voice may not be something I can hear, but I can definitely see it and be able to react and respond to it. So we're going to talk about understanding the ADLs. So you can't have personal care without going through what we call the ADLs. So the term ADLs, or activities of daily living, are activities that are done in the course of the day, right? Activities that we all do, from grooming ourselves to transferring. That means we're up, we're going from the bed, maybe to the toilet, maybe from the bed to the wheelchair, whatever, however we're transferring. We're eating, we're drinking, we're going to the bathroom. These are tasks that are done in the course of a typical day by everybody, if they're able physically. There are four areas when we talk about types of assistance with ADLs. The first one is we want to always offer encouragement. Number two, we want to present verbal reminders. Number three, visual cueing. And number four, a level of physical assistance. So, oftentimes when I hear new caregivers come into the field, one of the things they always say is, I don't want to be that person that wipes butt. And I'm like, okay, first of all, we are, in terms of caregivers or care providers, we are in such a vast range. Not all of us wipe butt for a living. And for those of us that do, I think they would be they would be offended if you reduce their title to that, because that's not any of our titles, right? So while assisting someone toileting may be part of our duties, it's not the full scope or range of all the things that we do in a day, a course of a week, a month, a year. Okay. So as you can see on my list, number one is encouragement. Now, I don't know about you, but when people encourage me, I feel so much better, right? I have this like this zest, this speed. I want to be able to do things better. I have this little perk in my step, right? Because I've been encouraged. Yes, you can do it. And when you did it, it was done. You did an amazing job, whatever capacity of encouragement you want to give. So, the first area that we're really going to focus in on is skin care and preventing bed sores. So, residents who have restricted mobility have a greater risk of developing skin breakdowns. The areas that are most often what we call those what we call the bony areas of the skin, where we don't have a lot of skin or fatty tissue, is elbows, shoulder blades, tailbone, hips, ankles, and heels are at greater risk of skin breakdowns. If detected early, a break in the skin can quickly heal. Unreported pressure injuries can lead to life threatening injuries as the bed sore gets worse. And so bed sores they kind of begin to appear in stages. So, stage one, skin is not broken, but the skin may look red or have a darker skin tone. Number two, skin is broken and may be pink, red, or blistering. In a stage three, the skin is broken, in which fat tissue is seen. Skin may appear to look scabby. And then stage four, full skin loss to all layers of the skin, and maybe even all the way down to the bone. So we want to make sure that we're focusing in on prevention. So on this next slide, it begins to talk about some ways on which we can prevent bed sores. Number one, keep skin clean and dry. So if you have someone in your care that is what we call incontinent of urine and or feces, we want to make sure that they stay clean. We also want to make sure that they stay dry. Remember those areas where moisture is kept under the breast, right? We want to make sure that we're properly drying the inner part of the thighs. I call it like the panty line for women. Those types of things. We want to make sure that we're keeping those areas dry. Reposition every 2 hours. If somebody is bed bound, we want to make sure to go and reposition them every 2 hours. Change clothing and linen as needed. So we don't want to keep them soiled. We want to make sure that we're changing the clothes. And we want to also make sure that we're changing the linen and that the linen is wrinkle free. Okay, so we want to take our time if we are changing linen to make sure that the beds are wrinkle free. And then the fourth one is pay attention to skin again under the folds, and then encourage plenty of fluids. So we want to make sure that we're pushing water. If they don't have a fluid restriction, we want to make sure that we're pushing water and keep them well hydrated. And then the last one, relieve the pressure. So it could be maybe we have to buy some type of assisted device to help relieve the pressure, but we want to be able to do something. Okay. So if you see something, say something. Don't wait until it becomes a stage 2 or 3 or even a 4 before we decide to make sure that we say something. We want to always focus in on prevention. Do you see how happy she is in the tub? First of all, she has like the neatest little tray and with all her little goodies, right, as she's getting prepared to take a bath. And bathing promotes health and well being. It also removes perspiration, dirt, oil, and dead skin cells from the skin. It prevents body odor, is relaxing, and increases circulation. So we want to make sure that we are encouraging bathing. Now, I always pause to tell this story because, first of all, it's funny. Second of all, I use it as a teachable moment. So, years ago, I provided care for a person, and I would always get pushback when it was time for her to take a bath or a shower. So, I would say, for the sake of the training, I'm going to call her Lucy. So I would say, Lucy, hey, it's time to take your bath. And Lucy's response would be, I don't take baths, I take showers. So then I would say, well, Lucy, it's time to take your shower. And her response would be, I don't take showers, I take baths. So we would go through this whole roller coaster all the time when it was time to take a bath or a shower. Now, the only way that I could was able to convince her to take a bath or shower is she would get, of course, the choice of socks. Now, I know you like socks. Yes, I'm talking about the socks that have the little characters on them. It could be SpongeBob, it could be Mickey Mouse. It did not matter what type of character as long as they were character socks. So she loved to change her socks 2 and 3 times a day because of the different characters that she had. So that would be the only way I would be able to get her in the tub. Is when I would allow her to pick the little character. Or sometimes it I would have to buy her new socks. So then she was super excited to put those on. So that would be an added bonus for me, as so I wouldn't have all the pushback that she would just be able to get in the tub. So just something to think about, right? When we talk about bathing, because I like telling the story because I knew, first of all, for her, it was very important. Bathing or showering was very important, and it was necessary because she was a younger woman who still had or was still getting her menstrual cycle. So it was just imperative for many reasons why she needed to shower on a consistent basis. So bathing, some things to remember is to wash the genitals, and the anal area should be washed daily, right? So the what we call the private parts. Um, be gentle when washing the skin of an older adult, right? Because we don't want to cause the skin to bruise or tear. If we're being too rough, make sure the room is warm. Nobody likes to take a shower or bath when when the bathroom is cold. So we want to make sure the room is warm. Encourage the use of safety equipment. Please, ma'am, sir, grab onto the grab bar. Those types of things. Make sure that the mat is inside the tub so they don't slip or fall. Make sure that there is something for them to stand on when they get out of the shower so they don't slip or fall as well. We want to remember to remind them to wash from front to back, not back to front, front to back. And then, last one, if your particular person or loved one that you provide care for is a male and they are uncircumcised, please make sure to remember to pull back the foreskin and be able to wash the penis the right way. So we want to make sure that we're washing to remove any dirt, bacteria, whatever the case is. Bathing is also one of those areas where you may get probably some, like in the case of my story, some pushback, right? So some strategies just to handle if you have somebody that kind of pushes back when it comes to shower or bathing is to, sometimes if they say no, maybe we'll try again in about 15 minutes. Number two, you may need to ask help from a peer because sometimes, you know, I may have a special touch with Nancy, but Jane can't get Nancy to budge on anything, right? We want to give them the choice of their PJs or clothing. So, like I said, I would always give her the choice of what kind of socks she wanted to wear because that was the driving force. And then encourage them, right? There is their word, encourage them with their personal cares, especially when it comes to bathing. Do they have a special particular soap, a soap brand that you can offer them that would kind of, not where you won't get so much pushback and they would just go ahead and get in the shower or tub. So, for me, I have that special fragrance. I have that special brand that I always consistently use. Just those types of things. We want to make sure that we're um, just being mindful of some strategies when we get some pushback. Okay, the next area that we're transitioning to is hair care. Hair care is an important part of personal care. Shampooing the hair removes dirt, bacteria, oils, and other materials from the hair. So we want to make sure that we are focusing on hair care and just being mindful of, right, the hair, how important it is, because that's the thing. Your face is right. It's like, okay, this is the first face I see, and I don't want to see my particular loved one. If I go to visit with my grandmother, I don't want to come see her and her hair is all over her head. Cause I personally gonna fuss at the whole team, not just one person, right? So we want to make sure that we're focusing on hair care, how they may want their hair styled, how they may want their wig put on. All those things are important when we're talking about hair care, right? Is it time for a haircut? Or are you just gonna let the hair grow all the way to the floor? Like what's your goal? Right? Like what's your goal? So just some of those different types of things. So focus on hair care. Good grooming gives you confidence, right? Like grooming affects the way people feel about themselves and how they look to others. Focus on clean nails. Those are that, takes us back some slides when we're talking about focusing on details. Hands and feet, right? Clean hands and feet. Dirty nails, absolutely not. Extremely long toenails, absolutely not. So just those types of things. We want to make sure that we're focusing on clean nails, shaving. So if your particular resident needs to be shaved, loves to be shaved, then if you don't know how to do it, we find someone who can, because some things just are not optional, right? If they need their beard shaved or trimmed, we're going to put those things in place so that they can get the things that they need, because again, it's a part of grooming. Dressing and undressing. So making sure that they're able to pick out what they're going to wear during the day as well as the night. Elimination. Hmm. Elimination supports eliminating waste, including stool and urine, is essential for maintaining overall health. Both stool and urine are the body's way of removing toxins, waste products, and byproducts of digestion and metabolism. Elimination supports digestive health, regulates electrolytes and pH, prevents toxin buildup, maintains overall comfort and health, reduces the risk of kidney and bladder issues. Now, we don't really kind of talk about elimination because we call it like the icky side of care, but we all have to go. We all go. This is something we all have in common, okay? Is we all eliminate in some form or fashion. So we want to make sure we're monitoring elimination because it gives us a window into maybe how well their bladder or kidneys are functioning. Those types of things. It gives us insight into whether a person is hydrated or not, right? So we want to make sure that we're really monitoring and focusing on elimination. Um, just to do exactly what the slide says, whether it's removing dirt, it is to get rid of toxins, or just kind of keep the metabolism or digestive system in balance. We want to make sure that whatever it is, we want to monitor elimination. Positioning and moving. Remember that those you care for who spend a lot of time in bed should be comfortable, that they change positions often. This helps avoid muscle stiffness and pressure or ulcers. Again, just kind of recapping how important it is to move and position. Remember to reposition every 2 hours if they are in the bed, and every hour if they spend a lot of time in a wheelchair. So I'm going to pause right here because I want to make sure that we all have the opportunity. So if it's an area that I may cover where you like, you know what, I don't even know how to do that because I've never been taught, then I want you to reach out. There's a number at the an email at the end of the slide. I want you just to reach out so we can share some training resources with you. If you're in the Wisconsin state of Wisconsin in the Milwaukee area, we encourage you to reach out to us so that we can begin to maybe tailor some specific training to you. So if you want to learn more about positioning and repositioning, we can do that and assist you with getting all the necessary skills and resources that you need. So remember also to use all the recommended safety devices for positioning and moving. Gait belts, Hoyer lifts, sit to stand, two-person assist, grab bars, whatever it is that you need, we want to make sure that you're using those particular things. Also, ergonomics. That means I am using bending my knees, are my feet, kind of shoulder width apart. Those different types of things. You want to keep yourself safe as well when we talk about positioning and moving. And then practice ergonomics. I just said it, to reduce injury. So just something to kind of think about, be mindful of as you may have to position or move your particular person that you provide care for. So we're going to talk about eating and hydrating. Proper nutrition in early life helps ensure health later in life. For the ill or elderly, a well balanced diet helps to maintain muscle and skin tissues and prevent pressure injuries. Eating and hydrating. Half of a person's plate should consist of fruits and vegetables, according to my choosemyplate.gov. Explain and follow special diets. If your particular loved one is on, or resident or whoever is on a special diet, first of all, you get to know what it is. You research and find out what it is before you explain it. Okay. So we want the job of explaining really to be left to the doctor, the nurse, the dietitian, the nutritionist, somebody who has the credentials to really be able to explain the diet. It could be the administrator, right? The director of nursing, whoever has the credential, the experience, the knowledge. Drinking water helps to prevent constipation and urinary incontinence. So, again, we want to encourage fluids, especially water, to aid in prevention. And then, last one, watch for signs of dehydration. So, one of the next slides we're going to talk about is observing, documenting, and reporting. We're using our senses to give us insight, to give us a window as to um, what we are observing, what we are documenting, and what we are reporting. So, when we're talking about observing, documenting, and reporting, we want to look for indications of a change in the resident's health status. Are they sleeping more than they used to? Um, are they kind of sluggish? Um, whatever the change is, you should be able to spot it and be able to report it before someone else. Use all of your senses to look, listen, touch, and smell. I always tell other care providers that your body has a look when it's healthy, when it's not. It has a smell when it's clean, when it's not. Um, so we want to make sure that we're looking, we're listening, we're touching, sometimes we're smelling. Depends on what capacity you provide care. Check skin for redness, rashes, sore areas, cuts, pain, and sensitivity. Report changes to your supervisor, nurse per the policy. Observe the resident. Were they less involved or reacted differently? And that, could be reference to their mental health. When you are assisting a resident with personal cares, this is a great opportunity to use your skills to observe and assess. The caregiver's role is a supporter and not a doer, okay? Especially in the area of personal cares. Well, again, we want to offer choices. Offering choice enables a resident to have a degree of control over her life. Number two, maintain dignity. Dignity is defined as a person's value or esteem being worthy of respect. Number three, promote individuality. It means finding ways to celebrate how each person is special. Number four, emphasize that promoting independence sometimes means allowing extra time for the person to try tasks on their own. And then number five, use positive language and show examples of asking for permission before starting any task. Like, is it okay if I help you with your shirt? You don't want to just walk and start buttoning up people's clothes or touching clothes or anything like that. You want to make sure that you always are asking. So, we're going to be talking about the 10 steps of the ADL process. Number one, do a self check. I just want you to pause right there and just kind of think about it. Do a self check. So, I'm not just talking about, like, do I have everything? I'm talking about actually putting yourself in check. Number one, your body language. Absolutely. Number two, right, is your hygiene in check? So before you can help me, have you helped yourself? Right? Have you taken a bath? Have you brushed your teeth? Have you combed your hair? All those different types of things that make it important. So doing a self check, gather equipment and supplies for the ADL. We don't want you going back and forth, back and forth, back and forth. I forgot. No, gather all your equipment and supplies. Ask for permission to enter a resident's room. Interact socially with the resident. Wash your hands. Explain the procedure for the ADL to the resident. So let them know what we're doing. Okay. Oh, well, you know what? I'm here today because I'm going to be assisting you with getting out of the bed. Okay. Don't just go in and start cranking up the Hoyer lift or anything like that. I'm asleep. Right? So just begin to explain to me what's going on. Encourage the resident to participate during the activity. Praise the resident for each attempt at participation. Observe and assess. Again, we're going to observe and assess. Okay, look, listen, smell, sometimes touch. We want to observe and assess. And then last one, wash your hands. Okay, so we want to wash our hands before, we want to wash our hands after. We want to wash our hands before, we want to wash our hands after. Okay, as, especially as it relates to personal cares. So gloves are super duper important and essential when we're talking about personal cares. So this next slide just gives us an activity, a reminder on how we should properly remove gloves. So if you forgot, here's a step-by-step play on how to properly take them off. Because there is a, how should I say, there is a right and a wrong way on when we are removing gloves. There is a right and a wrong way. The next slide before we move on is a video about how to properly wash your hands. So I just want you to focus on it. Take a few minutes to really listen again. And it's an area where, especially in the field of care, we are washing our hands consistently all the time. But what we tend to do as we kind of get more mature in the field is we start cutting corners. So instead of 20 seconds, now we're down to 2 seconds. And we really need to get back up to 20. So just something to kind of refocus on. So please, if you could just allow yourself to watch the video. All right, now it is quiz time. So there are a series of questions in the format of like a poll or survey. And so they're pretty interactive. So we're going to just kind of go through each question. I'm going to just allow you a few minutes to pick an answer, and then we just move on to the next one. So the first question says, before starting any personal care task, it is essential to, number one, complete the task immediately. Number two, explain the task, ask for consent, and ensure comfort. Number three, wait for the person to request help. Or last one, avoid eye contact. All right, good job. Moving on to the next one. How should you respond if the person you are caring for resists help with a personal care task? Ignore their refusal and continue the task. Insist they comply. Respect their choice and offer options or try again later if possible. And last one, leave them alone for the rest of the day. Moving on to the next one. What is the most important factor when helping someone with personal hygiene task? Completing the task as quickly as possible, ignoring personal preferences, avoiding conversation, maintaining privacy, safety, and respect for the person's dignity. All right, we're moving on. What is the primary reason for regular hand washing when giving care? To prevent hands from drying out, to remove visible dirt, to reduce the spread of infections, to make care to make the care process faster. Okay, we're moving on. When assisting with grooming, tasks like brushing hair or teeth, you should use only your own preferred products, only do it if requested, take complete control of the task, allow the persons to do as much as possible for themselves. Okay, we are moving on. What should you do with soiled items such as towels or bedding? Place them in a designated place them in a designated dirty laundry area. Leave them on the floor until later. Set them aside and handle at the end of the day. Wash them yourself without using a machine. Next one. What's the best way to prevent pressure sores in someone with limited mobility? Avoid moving them to keep them comfortable. Encourage regular repositioning and provide soft support surfaces. Only change their position once a day. Let them move themselves if they can. Okay, moving on. Why is adequate hydration important in caregiving? It prevents boredom. It helps to avoid falls. Only certain individuals need hydration. It supports health, energy, and bodily function. And moving on. If a person feels uncomfortable or embarrassed doing a care task, what should you do? Offer reassurance and adjust the task as needed for comfort. Continue as quickly as possible. Ignore their feelings and complete the task. Stop and avoid talking to them. And we're moving on. If a person feels uncomfortable or embarrassed doing a care task, what should you do? Offer reassurance and adjust the task as needed for comfort. Continue as quickly as possible. Ignore their feelings. I apologize. I did this one already. Let's move on to the next one. When assisting with personal cares or toileting, it is important to wash from back to front to prevent infection. Yes or no? All right, and we're moving on. I want to thank you for joining me on this subject of introduction to personal cares. Um, my name is Roslyn again here at Caregiver Chat TV. I want to encourage you just to subscribe and share. Every video that we host or post is absolutely free, free. But to receive a certificate of completion in any capacity, that is what you will pay for if we have to issue you a certified verification certificate. So, if you need a certificate of verification of this training, there is a QR code located at the bottom of each presentation that you can scan, and it'll take you straight to the payment where you can provide payment for this class. This Intro to Personal Cares class is $20, and upon again payment, the certificate will be issued either by email and or postal mail, whichever you prefer. If you have any questions or require further assistance, please contact us at caregiverchattv@gmail.com. Uh, my cell phone number is also included on the flyer. If you would like additional training in any of the subject areas covered today, please reach out to Standard of Excellence Education and Training Center. There is a link provided to them. I want to give a special shout out to Miss Coward and Miss Barksdale for sharing their thoughts. All material, again, the resources used to gather this material were from the CDC, Center for Disease Control. We also talked about some resources through myplate.gov. We use some of the textbooks, which is through Hartman's Publishing, referencing CNAs, medical assistant, and some of the phlebotomy content. Again, I want to thank you for joining me. And here at Caregiver Chat TV, we are learning to laugh more together as we learn and provide better care. So we want to thank you again. Make sure that you subscribe and share, and have an amazing day.